Welcome to the Suffocare Collaborative Module on blood pressure measurement in clinical settings and patient self-monitoring of blood pressure. The learning objectives for this module are to summarize the proper technique for measuring blood pressure, identify potential sources of variability in blood pressure measurement values related to technique, assess the impact of self-monitoring blood pressure programs in reducing the risk of disability or death due to uncontrolled hypertension, identify issues to consider in guiding patients in the selection of equipment for self-monitoring, and to review the validation process for automatic blood pressure measurement devices. Measuring blood pressure for quality outcomes. Blood pressure measurements provide essential information about a person's health. These findings can determine what treatment and healthcare interventions will be required to adequately treat the patient. Unfortunately, it is easy to incorrectly take a blood pressure measurement. Performing even a single step incorrectly when taking a blood pressure measurement can result in an inaccurate blood pressure reading of 5 millimeters of mercury or more. When several steps are performed incorrectly, it compounds the inaccuracy of the reading. This can result in improper treatment. In order to optimize the accuracy of blood pressure measurement, it is important to use proper technique and the correct equipment. Patient preparation prior to the blood pressure measurement should ensure that they have not engaged in vigorous physical activity or consumed caffeine, alcohol, or nicotine within 30 minutes of examination, have emptied their bladder prior to measurement and sat calmly for 5 minutes. During measurement, the patient should be positioned seated in a chair with their back supported, arms supported at heart level, no clothing between the arm and the cuff, legs uncrossed, feet flat on the floor, and not engaged in conversation. The blood pressure device should be calibrated according to the manufacturer's recommendations, and the proper blood pressure cuff size should be used. Cuff size and placement are important to ensure an accurate reading. Cuff bladder should encircle 80% or more of the patient's arm circumference. Palpate the brachial artery and center the brachial artery indicator cuff over the brachial artery 1 to 3 inches above the antecubital area. Recommendations for cuff size based on an adult arm circumference is delineated here. This chart can be found on the Million Hearts website in the action guide titled Self-Measured Blood Pressure: Action Steps for Clinicians. Once the proper cuff size is placed properly on the patient's arm, loosen the stopcock on the bulb by turning it several times before then tightening and closing the stopcock. Have the blood pressure gauge in good view. Inflate the cuff 10 to 20 millimeters of mercury above the usual blood pressure, or, if no previous blood pressures are recorded, inflate to 160 to 180 millimeters of mercury. Next, loosen the stopcock on the bulb so that the pressure decreases by 2 to 3 millimeters of mercury per second. If sounds are heard right away, deflate the cuff immediately. Let the arm rest for at least 2 minutes, or switch arms if possible, and repeat and increase the inflation target to 220 millimeters of mercury. Listen carefully for the first sound. Note the pressure at which the first sound is heard. This is the systolic pressure. Continue to deflate the cuff at 2 to 3 millimeters of mercury per second. Note the point at which the sounds disappear. This is the diastolic pressure. In some patients, the diastolic pressure never completely disappears. In these patients, note the point at which the sounds muffle. Record the chart as systolic over diastolic and which arm was used. If the patient has had an axillary node dissection, avoid taking the blood pressure in the affected side. If the patient has had a bilateral axillary node dissection, the blood pressure measurement should be taken from the thigh. As alluded to previously, many factors related to technique can impact the accuracy of blood pressure measurement to varying degrees. This chart depicts the potential size of the discrepancy relative to an accurate measurement for some of these factors and can also be found on the Million Hearts website in the action guide titled Self-Measured Blood Pressure: Action Steps for Clinicians. Proper equipment and technique are equally important for self-measured blood pressure monitoring. Self-measured blood pressure monitoring has been shown to improve adherence and health outcomes for hypertensive patients. It is different from and more convenient than ambulatory blood pressure monitoring, which requires specialized equipment to measure multiple blood pressures at set intervals over a 24-hour period. Self-measured blood pressure monitoring should always be accompanied by additional support, such as a one-time training session by a healthcare professional, during which patients should be observed to determine that they measure blood pressure readings correctly. Self-measured blood pressure monitoring is proven to improve blood pressure control when the patient-clinician feedback loop is used to provide personalized support and advice based on the patient's data. Clinicians can use self-measured blood pressure readings to help assess the effects of antihypertensive treatment, including medication changes and lifestyle modifications. Most of the methods shown to improve patient outcomes have used an automated oscillometric device. With automated devices, patients wrap a cuff around their arm and press a button to obtain a digital blood pressure reading. Automatic devices should be certified by one of the following 3 recognized organizations: the Association for the Advancement of Medical Instrumentation, the British Hypertension Society, or the European Hypertension Society. When recommending an automated blood pressure measurement device for self-monitoring, equipment should be certified and validated for use by the patient. The device should measure blood pressure from the upper arm. The patients must be able to use the device, and the method for sharing results, as well as cost and coverage of the equipment, should be considered. Clinicians should encourage patients to bring any home blood pressure monitor they use to their physician's office in order to measure its accuracy against a mercury sphygmomanometer or comparable device before the readings are accepted. In order to validate a home blood pressure device, the following steps, which take approximately 10 minutes to perform, should be used. A total of 5 sequential same-arm blood pressure readings, no more than 30 seconds apart, should be taken. The patient takes the first 2 readings with his or her own device. Next, the clinician takes the 3rd reading with a mercury sphygmomanometer or the comparable device. Then, the patient takes the 4th reading. The 5th and final reading is taken by the clinician with a mercury sphygmomanometer or comparable device. The results of the readings from the 2 devices should be compared. Blood pressure readings will usually decline over the 5 measurements. The final systolic blood pressure reading may be as much as 10 millimeters of mercury lower than the first. If the difference is 5 millimeters of mercury or less, the comparison is acceptable. If the difference is greater than 5 millimeters of mercury, but less than 10 millimeters of mercury, the calibration can be repeated. The device may not be accurate if the difference is greater than 10 millimeters of mercury. This procedure should be repeated annually or any time the patient obtains new equipment. There is no established target for how close the readings from the patient's cuff should be from those of the clinician's cuff. Validating the home blood pressure device can provide a general sense of the device's accuracy, which can be taken into consideration when reviewing measurements recorded at home. The cost of self-monitoring devices can vary among health insurance providers. Prices for a typical, high-quality device can range between $50 and $150. The Suffolk Care Collaborative Home Blood Pressure Monitoring Services Plan, which is in the Diabetes and Cardiovascular Clinical Improvement Program Toolkit, may facilitate identifying resources to assist patients in securing a device. These references are recommended as a resource to provide additional information on this topic. Thank you.